uterus, and it's where the tissue there becomes very raw and it bleeds very easily. It can be called an erosion, an eversion. Again, as Dr. Flippin called it, proud flesh, but I think that's not a term you'll see very often anymore. But that flesh or that raw spot can be painted over with some stuff called silver nitrate, or you may need an antibiotic gel or cream to put on it, and that will take care of the problem most of the time. Now, many ladies who've had hysterectomies will have their bladder lifted, a pelvic floor procedure with something called mesh. Well, on occasion, they come in bleeding, and we do the pelvic exam, and we can feel where that mesh is trying to work out. And when it is bumped against, you can have some bleeding. So if you've had a hysterectomy and you are seeing blood, it's not normal. So get it checked out. Another reason that a woman may bleed from the vaginal area abnormally is menopause. When you lose your estrogen, your vaginal tissues begin to get thin and dry, and they don't stretch very well. And so sexual activity is not very pleasant. It actually hurts sometimes, and those thin, dry tissues can tear. As a result, you will see some bleeding, and that can be addressed with estrogen creams. If you're not a candidate to use hormones, we can formulate another cream or a gel for you that has some vitamin E, some hyaluronic acid, something called DHMA in it, and it makes those tissues much more pliable. What can you do about heavy bleeding? Well, first of all, you've got to determine what the cause is, because all bleeding is not caused by the same thing. But some of the treatments are, if you are a young lady and having a heavy period, an irregular period, the most common treatment is the use of a birth control pill. The birth control pill will help decrease the menstrual flow. It will help decrease your cramping, and it will put you on a regular schedule, a regular pattern. So if you have no reason not to use them, that's an easy fix. If periods are just interfering with your life, say you're a cheerleader or you're an athlete, and it's not convenient to have a period, you can take a pill in a way that you don't have a period at all. The purpose of a menstrual period is to help you in your reproductive life. So if you're not in the market to reproduce right now, there is no issue with not having a period. It's okay not to. It's not like all that builds up inside you. It just doesn't form. Your hormones each month cause that uterine lining to thicken up. Then you have a little shift in the hormone about mid-cycle, and they start going down. And at the end of the month, you will probably shed off some of that lining, and that's your period. So if you are on birth control pills, the way they work is they keep that lining from thickening up, and so you don't have as much to shed off and bleed. So that's the way it helps with the heavy periods. If your childbearing is complete, you can have a procedure called an endometrial ablation. Now, an endometrial ablation is done by a GYN, a gynecology surgeon. You're put to sleep most of the time, and they go up inside the uterus with a laser beam, and they literally laser away the lining of the uterus. A scar forms, and theoretically, you no longer bleed. Now, you don't lose your hormone function, but you do lose the ability to carry a child, because when the little fertilized egg comes into the womb, it attaches to that tissue, to the uterine lining, and it starts to grow and has the support there until the placenta forms. So if that lining has been removed, the little fertilized egg has nothing to grab hold of, and usually about 4 to 6 weeks you'll miscarry because it just falls off. So if you have not had any kind of permanent contraception process, usually when you're endometrial ablation is done, a tubal ligation is also done at the same time. It is a day surgery, not a lot of downtime. I had one myself on a Friday morning, and on Saturday morning I drove a motorcycle to Nashville. So I say that to say this, there's just not a lot of downtime. It's basically waking up from the anesthesia. And again, no surgery should ever be taken lightly. But if you were going to have a hysterectomy only for the reason of heavy bleeding, you may want to consider the endometrial ablation. Insurance covers it, and like I say, there's very little downtime. You may have a watery discharge for a week or two, but other than that, not. 20% of the time, that lining can start some way to regrow, and you may start to have a period again. Usually it's much lighter. There are occasions where it just doesn't work at all, and your uterine lining just breaks through and grows, and you end up with a hysterectomy or either with a second endometrial ablation. And then progressing on, there is the hysterectomy, and that is where the uterus is removed. Now, there's some confusion about terminology with a hysterectomy. Some people say, oh, I've had a total hysterectomy. What does that mean? Well, it means the uterus and the mouth of the uterus, which is the cervix, have been removed, but you still have ovaries. A complete hysterectomy with what we shorten to say a BSO, which is a bilateral oophorectomy and salpingectomy. That means the uterus and cervix have been removed, as well as the tubes and the ovaries. So generally that's what's meant by a complete hysterectomy. You can have your uterus removed and keep your ovaries, and your ovarian function remains intact, meaning you don't have to start taking hormones. But if your ovaries are removed, you go into immediate menopause, what we call surgical menopause, and you do need to start some form of hormone if you are symptomatic, just to keep your bones strong and your vaginal tissues nice and moist. There are medicines, again, that you can use. Some people will put an IUD, an intrauterine device, in the uterus that has some progesterone component to it, and that will keep you from bleeding for a period of about 5 years. There are a few birth control devices other than the pill. There's a little device that we insert under the skin called an implanon. Some of you may know it as a Nexplanon, but they updated the terminology there. The Depo-Provera injection is also used to help with heavy bleeding, and that is a shot of a type of progesterone, progesterone that, or medroxyprogesterone rather, that keeps you from bleeding and you have that repeated every 90 days. One disadvantage of the Depo-Provera is weight gain. Even the product literature will tell you you'll gain about 13 pounds a year. Well, you think that's not that much, but 2 years is 26 pounds or more. So weight gain is a big issue with the Depo-Provera for some women. Now, our time is nearing a close, so keep these bullet points in mind. Heavy bleeding is not normal. It can be caused by tumors, hormones, just genetics even. Your mother had heavy periods, endometriosis. So there can be a number of causes. You've got to find the cause to determine the appropriate treatment. And when that treatment is in place, you should do well. Average age of menopause in this country is 53. So a woman who comes in her early 40s, I know she's got a lot of years to bleed, and you don't need to be miserable for a portion of the month because of a period, and that can certainly be remedied. If you have any questions, I would be most happy to answer them or see you in the office to help determine what the issue is. Again, I'm Susan Bentley, Women's Health Nurse Practitioner at Options Wellness in Muscle Shoals. We thank Knox Media for allowing us to bring you this information each week, and I look forward to seeing you again next Thursday at 11 o'clock. Have a wonderful week.
Mm-hmm.